This year we conducted really an innovation challenge where we invited a number of the innovative companies and startups in the New York, New Jersey metropolitan area to present technology capabilities for you. And the winner of this year's competition is Citus Health. And they have an exhibit over in the exhibit area, which I encourage you to take a look at a little bit later. And Citus is a software solution to help post-acute care providers transform traditional workflows into efficient digital processes. And one of the founders of their company is a practicing nurse, so she knows the kinds of issues and challenges that people like yourself face. Now, to give a presentation about the kind of work that they're doing is Shahid Shah, who is the CTO of Citus Health. And he is an internationally recognized and influential healthcare IT thought leader who is known as the healthcare IT guy. He's a technology strategy consultant to many federal agencies and a winner of the Federal Computer Week's coveted Fed 100 award given to IT experts who have made a big impact in government. He has architected and built multiple clinical solutions over his 21-year career, helping to design and deploy the American Red Cross's EHR system across thousands of sites. He's designed large group software and collaborative sites in use by thousands. And as an ex-CTO for $1 billion division of Cardinal Health, he helped design advanced clinical interfaces for medical devices and hospitals. I think you're going to find the presentation that he has quite exciting, and I would encourage you who have particular operations to think about deploying their system in your practices. Shahid.
Okay, that was a terrific intro, and I'm just coming from Florida, where we were doing a new install of our system at a home infusion facility down there. So exciting times for us, and so I just, with my remarks here before I jump in to show you guys what we showcased earlier is how many of you know Elon Musk and the idea of first principles? All right, good. So one of the things that we did when we were designing Citus Health, as was mentioned, we are in the post-acute care space. That basically that means that as you're leaving the hospital and you need more care, you are going to have the same problems that you do in the hospital, meaning you're going to have nurses and pharmacists and doctors and supply professionals, et cetera, working with you. But now you have the added challenge of everybody being dispersed. So that post-acute care world is actually quite tough. There's not a whole lot of software in that space. So what we started to do first is say, okay, well, how would we decompose this into first principles? Because the last thing we want to do is to say, I want to make Uber for healthcare. Like, what the heck does that mean? You know, I want to make XYZ for healthcare. Those things don't really work out well. And so what we ended up doing is to say, what does the world look like if we thought about post-acute care and what the most difficult pieces of that would be? And this is where I would challenge us in I'm amongst my peeps here, as I would say, a bunch of IT folks, technology people, innovators, is to really think very, very differently about digital health than we have in the past. In the past, I built 2 electronic health record systems in the past and sold those companies. So it's an area that I know really well where we just say, okay, how can I make paper go faster? How can I do all my stuff but do it online? But that stuff is now table stakes. So the question is, in post-acute care, what is the biggest problem that we have? The biggest problem is transparency of information and context when care is needed. Those are your 2 principal problems. And so that's what we set out to solve. So today you heard a lot about Deming measurements and systems engineering, and those are all just great topics. But really, the way that we wanted to think about this that was very different than everyone else is, how many of you heard of the term patient engagement? How many of you are sick of hearing about patient engagement? I see more hands that went up about sick of it than hearing about it. That was interesting. Well, the reason for that is it's a completely meaningless statement. When we walk into Walmart, nobody talks about consumer engagement. They just give us the stuff that we need, we buy it, and we leave, right? The idea that patients want to be engaged with us is a silly one. Patients want to be engaged with their family. Patients want to be engaged with their sports teams. Patients want to be engaged with things that they care about. Very little of that is the health insurance company, your post-acute care provider, et cetera. So about a year and a half ago, almost 2 years now actually, my co-founder and I, Melissa Kozak is her name. Melissa is a home infusion nurse. Home infusion is where if you are not able to take medication orally, you get your care at home through infusions that have to be, basically you have a little needle inserted into your arm, and you have medication infused. So if you need really strong antibiotics or you need really strong medication, that's called the specialty pharma business. So the first thing we said is, how do I get outside this world of patient engagement and instead talk about something that really matters more, which is patient support? So does that, if I thought about things differently, how would that look? The second thing is, should we try to solve easy problems or should we try to solve hard problems? So one thing is we don't talk about patient engagement, we talk about patient support. And the other thing is we don't do the easy stuff. We want to do the hard stuff. I mean, if you can keep a patient connected and information transparency increase when you're doing something difficult like home infusion or home respiratory or home dialysis, then it turns out the other stuff is much easier to do. So just with that setting now, I wanted to talk a little bit about what our product does, and that would help you understand then why we're showcasing it here. So we've already mentioned that the nurse part of this, if any one of you are building something out there and you're not doing it with a clinician, please stop, like right now. Get out of your cubicle, get out of your programming environment, and go spend time at a hospital, go spend time at a dialysis center, go spend time somewhere where someone is doing some kind of care, wherever it happens to be. Shadow a doctor. If you can't find one, Ashish Atreja is sitting right here. He'll let you shadow him all day long and learn about what he's doing. I mean, it's really, really important. So what we wanted to do was to pull the patient into the digital loop because what they're doing is very, 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 very difficult. And so when you think about this patient engagement part of this, what we wanted to say is, how do you do self-service? How do you do instant messaging or chat so that it matters at the time when they need it? Like instant messaging and chat is not new anymore. It's just the question is it being done in context where it's necessary? And then what we tried to say is, what are all the other things that patient support requires, which is all the forms and signatures and supply management, all the hard stuff that, it's one thing to say, well, is the patient engaged in their care? It's a whole other thing to say that the infusion bag that they need or the gauze that they need at home, is there or is it not? If the patient needs to come home and figure out whether or not to get their care, but it turns out the supplies aren't sitting there, that's a really, really hard problem to solve. So those are all the things that we ended up doing. And the third thing that we looked at, think not patient engagement only, but patient support. Do the hard stuff first. The easy stuff is done. Go do the hard stuff. But the most important thing I think we learned over the last year and a half is to say, how do we build in outcomes tracking? How do you know what you did mattered to someone if you don't put it into your system? So adding outcomes tracking, understanding bit by bit, where did the engagement occur, where did it not? Where did the support occur? How did I connect to people? Did I actually prevent a readmission? Did I prevent the wrong medication dose from being done? I mean, these things harm people and these things kill people, and our software can do that in many, many cases. If somebody uses it inappropriately, it may accidentally harm people by inappropriate use. If that's the case, then outcomes tracking is very, very important. And so we put all of that together into this self-service piece number one, which is educate the patient so you're not asking them to be engaged with you. They can handle whatever they need to on their own. So what you're looking at here is a screen up there that says simple questions like, for example, I need help, I have a question. When is my nurse coming? Where is my delivery? Now imagine you are getting infused with medication 5 hours. 5 hours a week, every other week. You set aside time, the nurse is coming by to begin that work, and it turns out the medication does not arrive at your home right before you need it. What are you going to have to do? You're going to have to reschedule everything and get that going again. And in a hospital, that's not a big deal, right? You're missing a supply, 15 minutes later, somebody's going to get it and it's going to come in. That does not happen at the home. Delivery drivers have to be sent out, and all kinds of big things happen. So whether it's home respiratory, home infusion, home dialysis, et cetera, these are all major tasks. So what we've done is to say, okay, let's do the hard stuff and make sure that there is digital triage available so that patients can get their own answers. This seems like rocket science, but it's not. There's nothing that hard about this. You just have to say self-service is more important than patient engagement. So what you're looking at on the screen, some of you may not be able to see it, is in the middle, it has things like there are air bubbles in my IV. There is blood in my, there's blood in my extension tube. Things like that scare the bejesus out of people. You have a child who's getting a home infusion done. An hour after the infusion starts, there's blood in the line. You're going to freak out. And instead of freaking out and calling 911 and getting into a hospital and getting readmitted, what you want to do instead is ask a simple question. Take a little picture, say there's blood in my PICC line, what should I do? 90% of the time the answer is do nothing, everything is fine. But self-service here matters a lot. You have to be able to read things to people, etc. Then these are examples of how if the patient support wasn't possible self-service, how do you initiate the chat between all the providers? So there's a physician who has requested the infusion or respiratory therapy or wound care or whatever. Then there are the patients, their caregivers, the nurses, the pharmacists who are managing the doses, the delivery drivers who have to get supply over there. All of this stuff has to be done in a unified way, completely transparent to everyone, and with complete context as to what is going on. So what you're looking at here are just simple pictures. That one picture that you see on the screen will save easily $200 and a single nurse visit who might not have to drive out 40 miles now. Just a simple picture. And that interaction that you see on the right-hand side, that's what we refer to as natural language, right? It's just a conversation. So from a technical perspective, what we've done at Citus Health is to say, we're doubling down and we're betting the idea of forms-based EHRs is dead. 10 years from now, everything has to happen via conversations. When you and I talk to each other, we don't do it with forms in hand and check marks, right? We have conversations. And if we do conversations properly, what that means is that as the conversations come in, we have things like natural language processing. We have integrations with Alexa and other voice recognition. So nurses can actually dictate into their phone. Patients can just request for help just by asking Alexa sitting next to the device to say, Alexa, call my nurse, right? Those are the kind of things that are just conversational. You have to think about that and say, how do I move from my form-based world where I'm just entering data over and over again to the hard stuff? Do the hard things first, not the easy things first. And that's what you see on the right-hand side there. As you go further, just little simple things are also there about automatic language translation. I mean, this will cause, if you are trying to do an infusion or a respiratory care or something like that, and the nurse doesn't understand your language or vice versa, this is hours worth of rescheduling. So part of our system is, it's natural language, automatically translated. This is like the Star Trek version is, in your app, I'm going to talk to you in English because that's my first language, but you may respond to me back in Spanish. Neither one of us should have to care, other than the fact that we know it's being automatically translated. Do the hard things first. I mean, these are so important that we leave the easy stuff on the table and say, okay, I'm just going to do it so where I do instant messaging. Well, that's the easy stuff. What happens if the two people don't speak their own language, the same language? Now, the outcomes that we've received, and this is what I'll spend a couple of minutes on, is improving care plan adherence. And when I say outcomes, we have numbers inside the software. Anybody building software today that is not tracking outcomes inside their software should be ashamed of themselves, number one, and nobody should buy from them, number two. If you don't track your outcomes, how do you even know that you did? Forget the money and the reimbursement and everything else. You're making assertions that my software does X, Y, and Z. How do you know that if you don't actually track X, Y, and Z? So improving care plan adherence, a reduction in ER visits and unplanned hospitalizations. These are not just things to talk about. I mean, these are real people's lives. If they don't end up in a hospital, cost is one thing, but more importantly, they don't end up in the hospital. Number 3, avoidance of adverse events, reduction in unscheduled nursing visits. Remember, in a complex visit, that nurse is in just as much distress as the patient is, because that nurse is running around across 90, 100, 200 miles, driving back and forth because some knucklehead at the home infusion or the home respiratory forgot to schedule them in the right order. So they send them 30 miles out one way and then 70 miles out another way. All you had to do was to know what the address was from a GPS and simple locator, and it would tell you, don't schedule these nurses to be working so far away from each other. Reduction in inbound and outbound phone calls, like our objective is to move to 0 phone calls that are not your expectation. Like there's many people that want to talk on the phone, absolutely talk on the phone, but if you don't like talking on the phone, you should not have to. And then lastly, increasing referral partner satisfaction. How do you know that the people that are referring people to you, like if I'm a home care provider, I have people referring them to me, how do I know that I'm the right care provider for the patients that they're referring? We seem to think that that's just something that's going to happen automatically. It doesn't. I need to track all of this so I can say, stop sending me these kind of patients because I'm not going to do a good job on them. But send me these kind of patients and I'll do a really good job on them. Right? There's all kinds of stuff that goes on there. So now, because our challenge here as part of the showcase was, how do you integrate? And so one of the things that we've talked about is we're doubling down on the idea that natural language processing and related items, very, very important, and forms are going to be out very, very quickly. The other thing we're doubling down on is focus on integration first and novelty second. As an engineer, I'd love to make new stuff, but I'd rather just integrate things that work, right? So how do we do that in this particular case? Well, we look at things like HL7. How many of you have heard of HL7? All right, good. This is definitely my peeps here then. So direct SQL access, FHIR, and other stuff. But really, what about just integrating with SMS? Right? Last year, I gave a talk and Health.Key News interview in which I said SMS is the digital health tool of the century. It ain't apps, it ain't anything else, right? So when you look at these things, what if we just integrate with email? What if we just integrate with SMS? Forget all the HL7 FHIR and everything else, which we support right natively, but what if the easy stuff that we could connect with at our practices would be the things that they're already using? And then we think about things like, well, it's illegal to use email or illegal to use SMS because they're not secure. But that's not true. We're not thinking about it the right way. That's why we say those kind of things. So just from a closing remarks point of view, we're going to be we're demoing at our booth next door, and I really appreciate NJIT. I've spoken at your events a couple of times, and it's always exciting to come down here to let us showcase. But what I'm hoping, and I don't know if we have a couple of minutes for questions, but if we do, I'd love to take your questions about doing some of these hard things. And if you have some questions for me as a CTO, that's great. Otherwise, we can give you guys a demo of our software when you come over to the booth over there.
Just raise your hand with questions. So I'd like to ask you, you had mentioned how important it was to have a clinician working with a technologist. Can you give a little bit of the story about how you met your co-founder and created the company?
No, I love that question. So a couple of years ago, probably at the end of 2016 it was, so I'm a blogger, I speak a lot and I write a lot, so I get lots of requests for people to say, hey, can you be a co-founder of my company? Can you do this? Can you do that? One day I got this call from Melissa Kozak. Again, she's a certified home infusion RN, registered nurse. And she basically calls me up and says, I've been taking care of thousands of patients over the last decade or so, and I've got some ideas for how that can be improved. That was it. That's the entire story. Like, you had me at hello, right? Because as a technician who has built these things before, that is like a dream when someone comes to me and says, I've been working with thousands of patients, and now I have some ideas. That never starts this way. It's like some crazy guy like me that says, hey, I think we should digitize something, or hey, I think we should remove paper out of things, and then you go ask a clinician, they're like, that's not my problem at all. I don't know what you're solving here, but that ain't my problem, right? So that is so, so important, and especially today. You could make the argument 10, 15, 20 years ago when I started that there was a lot of initiation of technology necessary by us geeks, as it were. But today, it's almost silly not to have a really good clinician who understands their problems, who can help describe them and lead that effort for you. Other questions? Yes.
So most of us have probably lived through the scenario that you provided us. Had some loved one at home trying to coordinate care. I know I certainly have. And I've lived with, 3-year text chains with 6 people, group chats, whatever. So the information that's populating in your SMS or your chat feature, is that then repopulating the medical record so that the next time there's a conversation you go in, you're not scrolling through? Yeah,
That's exactly right.
curious how that works.
That's a
Yeah.
fantastic question, because in today's world, if you are not integration first, you are a sorry application, right? I mean, anybody that's selling something anywhere, right, in digital health that says, I can't push things into an EHR, I can't pull things from an EHR, I can't combine it in a way that is shareable, nobody should buy those kind of tools. So for sure, it does that. The question really long term is, where does that integration go? Now, if you were to buy the argument from EHR vendors like myself that I've been for a number of years, that central store is the EHR. I don't buy that argument. I think long term, if you thought that that was the central store, it means that you believe that hospitals should center around the records room, right? That would be silly. Nobody would argue, nobody would agree and say, sure, let's build our hospital around records. No, you build your hospital around top-notch physicians who can provide top-notch care. If that's the case, then in this case, the integration really means, are we going to spend more time through email or Slack or other systems? And if that's the case, 5 or 10 years from now, we should be integrating into there. So we are integration friendly from the ground up with multiple APIs, et cetera. Right now, the winner is the EHR. Absolutely, we push data out into the EHR. So if you're looking at a progress node, you're looking at your record for a particular patient, all of that stuff will appear there. But I think we have to ask ourselves, we have to look deep within ourselves and say, is that EHR the right place to put it? And having built multiple companies in the EHR space, I find it completely okay to shoot myself in the foot and say, no, that's probably not where it goes. I didn't know about this.
Yeah. So I'd like to introduce Dr. Don Sebastian, who's the president and CEO of the New Jersey Innovation Institute, to help present the monetary prize for Citus Health for participating in the competition. In addition, they're going to be able to present at the Hackensack Meridian Bears Den competition as well.